So the spirometry we've been talking about are static lung measurements of volumes, capacities. And those are critical when being to be measured if you're following someone that has emphysema or pneumonia or lung cancer, things like that. So they will change. But to look at lung functioning, to see, especially looking at someone if they have asthma or COPD, is what we call FEV1 for 1 second over your forced vital capacity. And I'll show you what it would look like here. We would have someone just doing normal shallow breathing and then take the deepest breath possible and blow it out as quickly as possible. And what we look at is right here. We're going to look at the time when they began to blow out from here. We want to go out 1 second. And let's say, for instance, it brings us to here. So that's 1 second. And we want to look at this vital capacity, of course, is going to be, it's going to be this. It's going to be this volume right here. And so if I just eyeballing this, I can tell that in 1 second, this person blew out, like 90%, 80, 90% of the air. And so this is forced expiratory volume in 1 second. How much you can blow out in 1 second, what volume. And it's got to be divided by your vital capacity, because a big person, a small person. So this is what percentage of your lung capacity can you blow out in 1 second. And if it's less than, or if it's greater than 70 or 80%, you're doing great. You can blow out that air, you're doing great. But I'll show you an instance where it does not look so good. If you were to take that, another patient were to take this deep breath. See that curve? And here, if we were to go out 1 second, in that case, this may be something as low as, looks like 55%, something like that. And so when we see this, it's an indicator that you're not able to blow out as much of your lungs quickly. And it could be asthma. Now, if it's asthma, if you give an inhaler, get some albuterol, something like that, and it gets better, then that's asthma. But COPD, chronic obstructive pulmonary disease, usually chronic bronchitis, there's no improvement, no matter what drugs you give. And what this really is measuring, this FEV1 over FVC, is how big your tubes are. How big are your bronchi? And so you have a nice big open bronchi, or is your bronchi constricted and then filled with a bunch of mucus too, usually. So it's usually bronchoconstriction, like too much smooth muscle constricting it. And then you got a bunch of fluid and crap in there. And it could be exudate, it could be from white blood cells, or it could just be mucus that the cilia are not moving it. And if you look, remember, the radius is so critically important. Remember, it's the power of 4 when we looked at blood vessels. And this is the difference between trying to blow out or suck in from a big thick straw and a little tiny cocktail straw. The resistance is going to be so much bigger here. And that is the real problem when you look at it. I asked you that question in class, which is harder if you have asthma, to breathe in or to breathe out. And it's actually to breathe out is more difficult, because as you breathe in, your lungs expand and all these tubes expand. But breathing out, everything is collapsing, everything is coming down. And so it's going to narrow these tubes even more, make it hard to get rid of that air. So you should know this formula. FEV1 over FVC means how much you can forcefully breathe out as hard as possible in 1 second. What percentage of your vital capacity, what percentage of your lungs can you blow out in 1 second? So dynamic lung function, something that's tested to take a look at. Really, it's a measure of how clear the tubing is, the bronchi that leave your lungs.